Today's episode is brought to you by Microsoft Dragon Copilot. Learn how Dragon Copilot can transform the way you work. Stick around after the episode or visit aka.ms/knock-knock-hi. That's aka.ms/knock-knock-hi.
Knock, knock. Hi.
Welcome, everybody, to Knock Knock Hi with the Glaucomfleckens. I am Dr. Glaucomfleck, also known as Will Flannery.
I am Lady Glaucomflecken, also known as Kristin Flannery.
Welcome. Thanks for joining both of us and Milo sitting behind us. I'm glad he's here for this first part of the episode because I thought we could catch up after my very first veterinary medicine conference.
That's right.
I've been to almost every human specialty conference in one way or the other. There's a few. I haven't hit up a psych one yet. That would be interesting. That would be a fascinating one. Yes, who else? Plastic surgery, because
why?
I haven't had a character. I think I have one video I just recently put up, so we'll see if that entices them. Dermatology hasn't happened.
Okay. I don't think radiology.
Radiology. No, it has. Yeah. I did the ACR, American College of Radiology, the big one.
Anesthesia.
Definitely anesthesia. As multiple surgical fields, neurosurgery, general surgery, and anyway, I don't know. There's a few, OBGYN. No, I don't think so. That would be That'd be an interesting one.
Yeah, I want you to do that.
Yeah, right. But anyway, so this is exciting though, because I was just in San Diego for the let's see if I can get this right, International Veterinary Emergency Critical Care Symposium.
Wow. Yes.
And when I got this invitation, I was a little like my first thought was like, do they know I'm a human doctor?
Right.
Because a lot of people don't know what kind of doctor I am, or even that I am a real doctor, just because of like the content, the skits. It's kind of silly, but yes, they were very, very well aware that I'm a human medicine person, and not only did they purposefully invite me, but they came out.
Yeah.
They showed up. The room was full. There was probably maybe 1,000 people. Like in this,
like a ballroom.
In this ballroom,
yeah.
And there were a few costumes, and
What kind of costumes did they?
Well, I saw a couple emergency helmets.
Okay.
It wasn't like a lot of costumes, not like I would typically see at some other ones, but that's okay. It was like they were so excited and cheering and laughing, and just I could tell they're just good people.
Yeah.
And lots of young people too.
Nice. That's always fun.
Oh man, they get a lot of the young generation out to this
I wonder
conference,
how.
apparently. I don't know. Well, I do know. Actually, I did ask them. I asked the organizers that question, and I think one of the keys was in their admin group, they hire Gen Z.
Oh, funny! Imagine that.
Imagine that.
Representation.
Yeah, bringing people into the team that kind of know a thing or two about 20-somethings.
Yeah, that'll do it.
It helps, folks. I wish human medicine organizations all did that.
Yeah, it'd be smart.
Very smart. But one thing I wanted to point out was I did a thing that I was a little self-conscious about, because it felt like, okay, well, I'll just tell you what I did. So I showed a couple pictures of Milo. One where he's looking rather human-like.
Yes. Yeah.
But anyway, and I showed his eyes, and
we'll tell the people who are not familiar.
So Milo, sitting behind us, is a rescued standard poodle. We got him about 5 years ago, and one thing we learned about him right away was that he's got some eye problems. He doesn't see well. Part of his vision is obstructed.
The
lower part. He doesn't see well, so doesn't see things at his paws. Has trouble in new environments. Stares. He's very careful.
Yeah.
He's just very, very gently puts his foot on the next step, and until he's comfortable, and then he knows.
Right.
Like in our house,
a great job of mapping the territory.
Oh, he maps it out. He knows it.
You would never know if you didn't know.
So anyway, I so at the start of my talk, my keynote, I I showed a couple pictures of Milo, and then I realized in the moment, I was like, is this weird? Like, is this kind of annoying to? I was saying this to the crowd. It's
Right.
like, does everybody
Like,
come up here and
diagnose my
show?
pet.
No, not even that. Just like during a talk, like
Mhm.
does every speaker like show their pets to you?
Oh,
I was
Yeah,
like,
like
oh,
it's-
you must want to see all the pets in the world, kind of thing.
right.
And they I saw people like nodding their head. Oh yeah, people do that. And then my next question after they told me that this is a common occurrence, is that annoying? And just resounding no.
Oh, okay.
No, they loved it. But the reason I think I thought it was weird is because like I don't go, it'd be like if I went to an adult medicine conference, like, here's my grandparents.
Right.
Look at this picture of my cute uncles.
Right. Yeah.
Like who does that?
But
I don't know.
pets are cute. Grown uncles are not. So there's
Well-
a difference.
well-
Maybe like showing a baby at a pediatrics conference or something.
Yeah,
But I think even
maybe
then,
so.
who doesn't
Yeah.
want to see a random baby
Yeah.
in the middle of the day?
And then I was learning so much at this conference. I was like, what are I was thinking, trying to figure out what the overlaps were, like this. What do the veterinarians like get out of my content?
Right.
Right?
Why does it resonate with them
The
so much?
personalities apparently
Exactly the same.
Oh yeah, like nephrologists, like animal nephrologists and animal cardiologists, they go at it from
They
time to
still
time.
do,
Yeah,
okay.
oh yeah. And like the emergency doctors, they're all like thrill seekers.
Mhm.
So it's there's a lot of overlap there, which I thought was interesting.
That is interesting.
One thing I realized though, talking to them, was that there are no pediatrician like
Oh, interesting. Yeah.
there's no like puppy doctors.
Right.
They,
Yeah.
they're just all.
Well,
but there is actually.
Perhaps because puppies are puppies for about 2 seconds.
That's true. Yeah, it'd be tough to sustain
Yeah.
that kind of a practice model. But I did learn that there is actually like a new, maybe only like one place in the country that does this, neonatal veterinary medicine.
Oh.
So like, you get the preemies,
yeah.
like try to keep the little animals alive. I don't know.
Mhm.
I don't know if that's like just your like general like dogs and cats, house pets, or if that's
Mhm.
like more in the zoo, like,
Okay,
we
yeah.
got a premature panda.
Right.
You might want to put more
right.
resources into like the endangered species.
Right,
Like
I could see that.
So that does make sense, but I don't know. I like in a couple of the reason I'm talking about this is because I think it's something like a lot of physicians, a lot of medical people should know, but also it's just interesting in that we did in the Q&A after my talk, some interesting things came up. And one of them was I guess there's this sense that, or they get the feeling that they are looked down upon as medical professionals compared to human medical professionals,
Interesting.
which I've never heard, I've never
Yeah.
seen. Then again, I don't interact in the veterinary world very often, right?
I guess, but like you do interact in the human doctor world and you've never heard.
I've never
You've never
seen.
caught
No, I've
wind
never
of
seen
such a
that. But
thing.
it doesn't matter if I've seen it. They've seen it, and it was like
Right.
something that came up, and it seemed like a lot of them like recognized this as true, and
Uh-huh.
so it was kind of alarming. It's like what do you like? I can't even imagine how hard their job must be.
Yeah, all those
Like, what
different
do
species.
I'd say we just have one species to
Right.
deal with. My God,
yeah.
like what are we doing? We shouldn't be bad mouthing any
No.
veterinarians. Come on, dog, cat, bird,
Yeah.
snake.
I don't know.
And
Rodent.
I was talking to the CEO of this organization and just asking about like, what is your day like? What is it like being an emergency? And it's a hard job. It's a really hard job. A lot of people are leaving. Very similar to human emergency medicine. Like you get burnt out
Yeah.
because that's the only part of veterinary medicine where you work all hours.
Right.
You're on call. Like that's being on call.
All the time.
Not really a thing unless you're like in a very specialized like zoo environment type of thing, right?
Mhm.
But like as just your general, you go into your local community, you have like an
Right.
emergency room
Yeah.
for vet for
Those
dogs.
24/7 animal clinics.
Like that's the only But your average vet is not, like I'm on call for all my patients.
Yeah.
Like that's not a thing in the veterinary world.
Right.
Like your average clinic closes at 5, and if you have something happen to your pet overnight, you go to the emergency room. You don't have the option of calling your vet at like
Right.
2:00 in the morning, right? Which I totally get. Like, I mean, my God, who wants to be called at 2:00 in the morning? But what he said, something that made me realize, oh, this is like probably one of the hardest jobs in medicine. Is like if you're an emergency room veterinarian, like someone could bring in like their armadillo.
Right. Is that legal, I wonder?
Oh, sure. Oh, well,
Don't they
maybe. I
carry
don't know.
disease?
Leprosy, but yeah,
Yeah.
that's neither here nor there. Just the 9-banded armadillos,
Okay.
which I don't even know what that means, but whatever. But like, that or like an iguana or a
Uh-huh.
parakeet. It's like,
Right.
so I asked him, I was like, well, what do you do? Because I'm sure 90% of the time you're seeing dogs and cats.
Right.
So you're pretty good with dogs and cats.
Yeah.
So what happens when someone brings in their chameleon?
Right.
And it's like, well, we have a network of like people. Either somebody, right? Like the people, the vets in
Okay.
your community. You can, hopefully you have someone you can call up, be like, what the
Your
hell?
local
What is-
herpetologist.
Yeah, hey, herpetologist. What's going? Can you help me out here? I got a chameleon with
I can't find him.
with hypertension. I don't even know what the problems are for reptiles. Anyway, it was fun. I just got so excited. I go to so many human conferences, like, oh, something different. Like
Yeah.
I was walking around the exhibit hall. It's like the first time
Yeah.
I've had fun in an exhibit hall
Oh.
in quite a while.
Why?
Just seeing all the different things. Because like human conferences, like you see the same stuff. Like
Yeah.
it's the same company selling the same, like a lot of the same things. So it was fun to like just see, oh, what are the equipment things that you would want in veterinary world, and everyone was really nice, and there was ultrasound. That's as big in humans as in animals as it is in humans. And also within 5 minutes of being in the exhibit hall, someone handed me a puppy.
Yeah.
So
That's not surprising. I'm jealous though.
how could that not put you in a good mood? It's just,
I know.
yeah, it's because puppies.
Yeah.
It's puppies going around.
Everyone should just get to hold a puppy while they're sitting there listening.
Absolutely. And here's the last thing. I want to say about this veterinary experience. One thing in going back to like the conflicts between like human doctors and veterinary doctors.
Okay.
Is that we don't do it. We got a problem over in human medicine. We tend to bring our dogs and cats, our pets, in to see the vet and think we can use our human expertise to
Well, that's annoying.
throw our weight around in the veterinary clinic. That's a thing. And because the reason this came up is, number one, we were talking about like they're all wanting me to do more vet content. It's like I would love to, but I don't have that. Obviously don't have that expertise.
Yeah.
So can you give me something?
Right.
Personality, relationships, any kind of overlap. And then they gave me this. Oh, well, you human doctors, you think you know everything about pathology, pathophysiology when it comes to every living thing on earth.
Yeah.
I was like, I can work with that.
Yeah.
That's good. So they're gonna send me like, I want like, the little things that we say, the digs, the slights, the pet peeves, no pun intended, to flesh out that dynamic, because that would be fun.
Right. Which, side note to the listeners, if you are of a specialty that you would like to be represented in the Glaucomflecken universe that currently isn't, that's exactly the kind of things that he needs to know in order to create all of his characters.
Here's the best part. As soon as we finished talking about that, the next question was, well, did you know what's wrong with Milo's eyes? Have you taken? And I said, oh, he's just got deep set eyes, got like a prominent third eyelid. And they're like, well, have you taken him to see an ophthalmologist?
Yeah.
I was like, no, I'm an ophthalmologist.
I am an ophthalmologist.
I was doing the thing.
You
I
were.
was doing the thing that they said that doctors do. I know. I'm an ophthalmologist.
Uh-huh.
I know what's going on with his eyes.
Yep.
Oh my God. I felt so.
What did
I
they
got
say?
a big laugh.
Yeah.
Got a huge laugh. And I accepted it. Full responsibility. All right. Let's take.
Well, I have a question though. Did they think that anything could be done?
They mentioned like there were like a couple things. I don't I have to. Basically, I just need to take him to see a
I'm just
veterinary
curious, like
ophthalmologist.
what the difference
Yeah,
would be.
I don't know. We didn't
Yeah.
really get into it, but all right, let's take a break.
TBD.
Let's take a break. Hey, Kristin.
Yeah.
I know that you love when I talk about the cute little mites.
Mm-hmm.
Yeah, but I thought we could take a break from that. Is that okay with you?
That's fine.
Yeah, because I'd like to focus on the eyelid symptoms and disease that an overgrowth of Demodex causes.
Okay, I like that idea. No mite talk.
So Demodex blepharitis, it often gets misdiagnosed or just missed entirely because a lot of symptoms overlap with other eye conditions.
Okay, so what are the top symptoms that people should look out for?
Usually itching along the eyelid margins, swelling, irritation, redness.
That sounds like it could be allergies or lots of other things too.
It could be a lot of things, but exactly. And the key is if your doctor spots crusties on the margin of the eyelid.
Technical term.
Well, yeah, we call them collarettes, but crusties is a good term. That tells you it's Demodex blepharitis right there.
Well, I really like that there's a clear sign to know for sure.
And once you're diagnosed, there's a prescription eye drop treatment available for this disease.
Oh, that is good to know.
To learn about the common symptoms of Demodex blepharitis and more, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. Hey, Kristin, it's September. You know what that means?
Yeah, my birthday.
It's also Sepsis Awareness Month.
That's true.
We need to talk about a podcast that every clinician should know about, the Sepsis Spectrum. It's hosted by clinical care educator Nicole Kupchik.
It's a good one.
It is. Each episode is about confronting blind spots in sepsis and antimicrobial resistance education. A lot of this stuff doesn't make it into textbooks.
Yeah, and it's super important.
Yeah, you can listen to the Sepsis Spectrum wherever you get your podcast or watch it on Sepsis Alliance's YouTube channel. To learn about how you can earn free nursing CE credits just by listening, visit sepsispodcast.org. All right, so I thought what we could do today, here in a little bit, is, I've been doing this series with First Aid where I randomly select
Yes.
a topic and make a skit about it. I thought we could do that on the podcast.
Okay.
Because you're a layperson.
Yeah.
How do you like that term, layperson?
It's
Hello, lay wife.
layperson.
You're my lay wife.
I don't like that.
Why?
No, I don't know, but I don't. Immediate disgust.
Lay spouse?
Nope.
It's like
That's just
it's like
French.
Le spouse? Okay. So anyway, but you have not been to medical school, so I thought
correct. But I do have a base level of knowledge.
Sure. But
of biology. I have
yeah.
some college level and graduate level.
True.
So I feel like I'm a good proxy med student, like a beginning med student.
Okay, yeah, like your incoming first year.
Yeah, or at least almost.
All right. So what we'll do is here in a second, I'll have you, I'll give you a range that you choose a number between. And then I will teach you a medical topic on the fly. We have not planned this ahead of time. So we're just I'm going to pull this up and I have the book right here and we'll just do that.
So whatever number I choose, you'll go to that page.
And I think this is actually appropriate because of something that happened on Twitter the other day. I went viral again.
I never like it when you go viral on Twitter.
I know. It's always terrible.
It's never good.
All right. So here is the tweet I reacted to. I said something about.
Okay.
So I'm going to tell you now this is not my tweet, what I'm about to say. Okay. So here it is. I saw a doctor over Zoom to get ADHD medication. And when I asked if it was safe to smoke pot on Adderall, she said, quote, "Let me Google it." Kind of tongue-in-cheek way of phrasing that, right? Obviously, it's kind of mentioned, saying it as trying to be funny.
Yeah.
What is your initial reaction to that?
My reaction is never a normal person's reaction.
From a what if your doctor did that?
I would be fine with it. Like, I would rather they look something up if they're not sure than just give me some guess to protect their own ego or something.
Yeah, I totally agree. This is what I said. I said, because I saw some of the reactions to that, some of the comments that were kind of like, oh, that's not a good doctor. That's not, So
Right.
I said, hot take. This is a sign of a good doctor.
Oh.
And I was not thinking this would be like controversial. I thought most people would be like,
you said hot take.
okay, all right, true. All right, maybe slightly. I was more saying that like facetiously, like it's not really a hot take, but like I'm just saying it's a hot take. If that probably doesn't make any sense, but in my head it made sense.
You're being facetious.
Yeah, it's kind of sarcastic. Hot take. This is not really a hot take, but whatever. And I did get. I mean, that got let's see, over almost 1 million people saw that tweet, and not surprising, like a lot of people were like, I don't want my doctor. They should know. You don't know about interactions between ADHD medications and marijuana. How is that something you don't know? That kind of thing.
Yeah. I mean, depending on what kind of doctor you are, where in the country you are, whether it's legal there or not, right? Like, there's so many factors.
Right. So this got into a lot of discussion. A lot of people were having arguments in my mentions just about what it means to be a doctor and to go through medical education.
Yeah.
And like, there's so many people that still feel like we have an encyclopedia brain.
Right. And that's the best way to be a doctor.
There's this big filing system up here, and I just like, let me go to the ADHD drug interactions pot. There it is. Okay, here's that's not the way it works.
No, I think plus I've studied neuroscience. Like, memory is not a snapshot, right? Like, memory is faulty. So if my doctor is relying on their memory alone, I might be a little concerned, right? I think what I would rather have a doctor be good at in the 21st century is you have learned about all those things in the past. You understand how they all work, and you know where to get the information and what makes sense to go together and what doesn't. Like, you know how to find the correct information for this particular patient. And I don't know. I would feel much better if I went to a doctor and that's what they're doing. I don't need them to have it in their brain.
So there's different ways a doctor can respond to that question. Like, they could be like, oh no, it's fine. Kind of brush it off.
Yeah.
They could say, I'm not sure. Let me look that up. Let me Google it. And when that person says, let me Google, people were latching on to like using Google. I'm like, well, they're probably using it colloquially. Like, I'm just going to look it up.
Or this
how often do we say, I'm just going to Google it?
Who made the tweet maybe the physician did say, let me look it up. And he's just saying, Google it.
But the point is, we do have to look stuff up.
Right.
And like, I remember when I first came out into practice, I was trying to hide the fact that I would need to sometimes like leave the room, get to a computer or my textbook or whatever it was at the time. I'm dating myself because I still have textbooks.
Right.
And go look it up. And eventually I just like gave up that because I got feedback from people online because I would talk about this and people would be like, just do it right there in the room. Like, do it with the patient. Like, it shows that you care.
Yeah.
You care enough to make sure you get the right answer. And also, part of going through medical education as training is understanding what is good information.
Yes, that's what I'm saying.
Right?
Yeah.
And what is not good information.
Right.
Like, I know what the good resources are.
Right.
So anyway.
You could tell if something is nonsense, even if you are Googling it. Do you think, though, that for younger doctors, because you said it was right when you came out of training, started practicing, I could see an argument for younger doctors to feel like they need to not make it so obvious that they're looking something up, because then the patient might feel like, because they're young and they don't know, that maybe this is like not the doctor they want to have.
Yeah, I can see that, but I also think part of it's just confidence.
Yeah.
In making your decisions.
Right.
Like, if you're fumbling over your words and like clearly you're maybe you're just nervous because you're a new doctor in new practice. I mean, and that's why, it can come across like you're a new doctor. Yeah. Um, but I think as long as you're inquisitive and you have a good rapport with the patient, like,
Well, and
and you
everything
take
you're
the time,
saying
you
is
take the time.
clearly demonstrating your knowledge.
Yeah, right? Exactly. So, anyway, I was just kinda surprised whenever I put that out there. It's like,
Yeah.
"Man, really? This is like a lot of people."
Touched a nerve.
It kinda did, and
I'd be interested to see if that also touches a nerve on other platforms, because do you think it's something inherent about the general audience over there on X that, you know, there's a bit of a selection bias happening? Because they all have a different flavor. They all have a little bit of a different audience.
so X is certainly leans more conservative, but also it is the platform where people go to try to have arguments.
Exactly. That's what I'm saying.
Yes.
So, like, on some other platform, this might not be so controversial.
Yeah, Instagram seems like a "Rah, rah, way to go,
Yeah.
I agree,
Yeah.
fun." I don't know, I guess there.
Sharing information and
Yeah, like,
also
but,
a
like,
little happier. Yeah.
right, doesn't seem to be as much, back and forth,
No,
right?
correct.
Is that fair? Because I don't use Instagram a lot, you know that, but that certainly seems to be the case.
Yeah. I mean, you can make comments and you can send DMs, and,
I would
there are
say
ways to interact, but you're not going to get, you know, how many ever
yeah,
comments you have on this, thousands of comments.
I would say, TikTok is surprisingly there's a lot of controversy and back and forth and arguments that happens in the comments.
Hmm. Interesting.
More there, I would say, certainly more there than Instagram.
Yeah. What
Uh,
about YouTube?
YouTube, I would if I'm ordering them from,
Mm-hmm.
like, most comment arguers to least comment arguers,
Mm-hmm.
more the highest chance that you as a poster are going to get sucked into an argument with someone
Yeah.
and waste half your day.
Yeah.
All right. Top of the list is certainly Twitter.
Yeah.
And then
Always has been.
then I would say TikTok.
Okay.
Then I would say YouTube. And I'm realizing I am way too on social media that I
Yeah.
know all this. Then probably Facebook, Instagram,
Okay.
and then LinkedIn. I don't know.
LinkedIn
Do people
is pretty supportive in general.
is it? Yeah.
Yeah.
Okay.
I mean, it's
Right.
professional, right? People are being professional on
Right.
LinkedIn. So if you are going to have an argument, you're going to have it in a professional manner.
Right. So I mean sometimes I post things on Twitter. I don't post very often, but when I do, sometimes I do it because I know, like,
You're
I'm
stirring the pot.
kinda poking the
Mm-hmm. Poking the
poking
bear.
the hornet's nest a bit. And then I just kinda leave the chaos to itself and just leave and go do other stuff.
Yeah.
It's kinda fun sometimes.
Oh my goodness.
People can't help themselves. I don't know. It's funny. Okay, so I tell you what, for our medical topic, let's
'Kay.
take one more quick break, and then we'll come back and do that.
Okay.
All right, here we go. First aid. I have USMLE, first aid for the USMLE, step 1, 2025. So this contains, for those of you not aware, this is a book I used. It's a massive review book. It's literally like 750 pages. And
Is it fair to say it's like med school in one textbook?
med school in one textbook. So what that means is the bare bones basics of what you need to pass your board exam to become a physician. When you get into other specialties or even to get into any job in medicine, like, you're going to have to go into more detail than what this is.
Right.
Right. But this is like, you have to know this stuff.
Yeah.
Doesn't mean you have to memorize the whole damn thing.
Right.
All right. But it's got to be in your brain. You have to understand it. You have
Yeah.
to understand the pathophysiology, all this stuff. So anyway, all right. So I want you to choose a number from 32 to 706.
444.
444.
What do we get?
Oh God, we got chemotherapy drugs.
Oh boy.
Oh, geez. Oh my God. Can we do a different one?
We already took a break. You
This,
can't.
oh my God, this scares me. Okay, all right. Oh, geez. All right, we'll do this.
The whole page is chemotherapy
Yes,
drugs?
it's a big grid. It's a grid. It's got drugs, mechanisms, clinical uses, and adverse effects. Okay, that's all right. It's all right. Let's. Okay. Okay. All right. So let's just talk about like chemotherapy drugs in general. Like, how do they work?
Okay.
All right. This is very basic. So there's different. Basically, usually you're targeting something along like the cell differentiation or cell division pathway,
Mhm.
right? Because you're targeting something about these tumors that's causing them to divide too much and take over your normal tissue,
Right.
right? That's what a tumor does. Just it takes and takes. All right. So there's different targets along the way from synthesizing the DNA, synthesizing RNA, dividing those things to form new cells, cellular division, protein formation,
Mhm.
all that
Yeah.
that cellular pathway.
Right.
And so one of these is what's called oh geez, okay. Goodness. Okay. You have all right, we're just gonna do anti-metabolites. It's called an anti-metabolite.
Okay.
So these are medications that basically interfere with that like nucleotide DNA replication
Mhm.
to cell division pathway.
Question.
Yeah.
Normal cells also have that pathway.
Right?
So I guess that's part of why chemo is so hard. It's also doing that to the normal cells.
Yeah, but what it'll do, there's something in the medication that, and this is way outside my area of expertise, but that allows it to target like certain enzymes or markers specific to certain types of tumors.
Oh, okay.
Because a tumor, I mean, it's not your normal tissue. It's not like if you have a
Mhm.
liver cancer, the liver cancer cell is not going to be identical to the liver
Tissue,
cell,
yeah.
the normal liver cell. So there's something that they take this medication and then allows it to focus in on the cancer cell
Right.
specifically.
Okay.
Okay. And so you have these anti-metabolites. Some are called, we're just going to go over a few of these. Here's one, 5-fluorouracil. 5-fluorouracil.
Why is it called that? Why do you do this to yourselves?
You know what?
Why are these the names?
It's a good question. Because these are all organic chemists that come up with these things. And they are much smarter than the rest of us. They
Yes.
think this is normal.
Right.
They think it's and then what we really should be asking, because actually the generic names often make more sense than the brand names.
Yeah.
Those are the crazy names that you
Right.
get.
They
That's
just are
what
like
on
completely
earth?
made up.
What on earth are you talking about? All right. So let me choose one of these. Okay. All right. Here's a common one. That's an anti-metabolite, methotrexate. Have you heard of methotrexate?
Yeah.
Yeah. So this is a folic acid analog. So you need folic acid in order to help with DNA synthesis.
Okay.
All right. That's part of why
Pregnant
in
ladies.
pregnancy
Mhm.
you take folic acid because you want that baby's DNA working well.
Popeye DNA.
That's right. And so the methotrexate is kind of like folic acid.
Mhm.
Now, what it does is it competitively inhibits an enzyme called dihydrofolate reductase.
Okay.
DHFR, dihydrofolate reductase. So
Okay.
it competitively inhibits. That means that
And reductase means it's breaking that down.
exactly. So basically what it ends up doing is just decreasing DNA synthesis. So you need dihydrofolate reductase in order to synthesize DNA.
Okay.
So this competitively inhibits
Right.
that enzyme. So it joins to it in some way that makes it not work.
Okay.
Okay. And so you use this. Methotrexate's common in leukemia, lymphoma, blood-borne cancers,
Mhm.
sarcomas. So a lot of these medications, these anti-metabolites, these anti-cancer drugs, they work for lots of different cancers,
Mm.
in different forms, right? I guess there's some similar characteristics of a lot of
Right.
cancers.
Yeah. Makes sense.
But with methotrexate, you can use it for non-cancers as well. So
Like
it's
what?
used in ectopic pregnancy.
Oh,
All
okay.
right, so it's like a treatment for so basically that makes sense. If you need folic acid for pregnancy, well, if you
Right.
block it, then or you competitively inhibit against it, then you're going to do
Mhm.
the opposite. It's going
Right.
to harm a pregnancy.
Well, and also if an ectopic pregnancy, is that different enough tissue from wherever it might have attached itself to be able to target that specific thing?
I don't think it matters because no, you'll also use methotrexate for like just a regular pregnancy. So it's just an
Okay.
abortion
Just across the
medication as
board.
well. Yeah.
Okay.
Just it doesn't matter where it is because methotrexate is typically it's an oral medication. Yeah. So it's so it'll just work systemically.
Yeah.
Um and other things like psoriasis, I've seen a lot of patients use that for, you
Mhm.
have,
The
skin
scaly stuff.
problems. Yeah, yeah. So, but the problem and one of the challenges with all of these chemotherapy medications is they have a lot of side effects.
Yeah.
Right. So
Don't feel so good.
it can affect your lungs. It can affect your kidneys. Methotrexate in particular can result in myelosuppression, which is basically it suppresses your bone marrow.
That's no good.
Yeah, yeah. So
Kinda need that.
that's why whenever you're on these medications, like chronically, you have to get all this testing done,
Yeah.
like your blood counts to make
Right.
sure that they're not tanking. So you got to try to find the right balance of treating the medication, but avoiding those adverse effects.
How come if we were just talking about how it's able to target cancer, how come in these cases it's targeting the kidneys and the lungs and whatever else you said, bone marrow?
Yeah. Again, it's like because I think there's enough, and I'm trying. I don't want to overstep my
Ask the
education here.
ophthalmologist
Well,
oncology
I mean,
questions.
because I'm giving this to you as a physician who has gone through
Right.
medical
Med school.
school, right? And so I do know a thing or two, but I'm not an expert.
Right.
I'm not an expert oncologist. But these medications, there is a lot of overlap in the cancer cells and the normal cells, right? So
Mhm.
it's because like things like cancer cells or embryos
Mhm.
are dividing so rapidly
Right.
that it makes sense. It's using all these cellular resources that it's going to be more dramatically affected by these
Okay.
medications
Mhm.
that block those pathways versus your normal cells,
Right.
which aren't dividing as much. Like your kidney, yeah, it's going to be making more cells, but it's not trying to grow another kidney
Right.
like a tumor is, right?
Right.
And so because you have such rapid cellular division,
Mhm.
um,
Just ends up taking in more of the
yeah,
drug
it's
essentially.
going to be affected more prominently by these medications.
So
But
is
that doesn't mean the medication won't affect your regular cells.
Right. But is that what you mean by it can target the cancer? It's just because the cancer grows faster, so it gets more.
Right. I think there are some therapies now, like they're trying to specifically target like tumor, like
Yeah.
markers that target the tumors themselves. But there's other ones that are just, they act systemically.
Yeah.
They just target these fast growing tumors.
Right.
So, I mean, there's lots of different types of chemotherapy agents,
Sure.
And I think as we, you know, one thing for as long as we still have research funding, we're going to keep kind of coming up with more like targeted
Yeah.
cellular
Personalized
things. That's what like Derek Topol's always talking about, right? Like making something so you're going to have your own personal medication cocktail to be able to treat whatever your illness is.
Right.
So. Woo!
Interesting.
All right, we
You
did
did
it.
it.
Oh my god, that was harder than I
On the
thought.
spot too.
Was it interesting?
Yeah.
Did you like that?
Yeah. I mean,
Okay.
I'm a pretty big nerd, as you know.
All right, good,
So
good. Well, we'll see what the audience thinks.
yeah. I mean, it's a bunch of mostly healthcare professionals.
that's
I would
right.
say that they
Even
are
if you're not.
equally nerdy.
Yeah, even if you're not. All right. Well, thank you all. That is our episode of of Glauc Talk.
Yes.
I didn't even say it was Glauc Talk. I think people just assumed
Yes.
it was Glauc Talk. And let us know what you thought. If you have any topics, anything in healthcare related, even minimally healthcare related, you want us to discuss, let us know. You can email us, knockknockhi@human-content.com. Visit us on our social media platforms, or hang out with our Human Content Podcast family over on Instagram and TikTok at Human Content Pods. I got some great pods over there. Thanks to all the wonderful listeners leaving feedback and reviews. If you subscribe and comment on your favorite podcasting app or on YouTube, we can give you a shout out. Like at Joni Dorsey 6116 on YouTube said, "Great episode. Dr. Potter is my new favorite superhero."
She is a
Me too.
superhero.
Now, almost every time I give a talk,
Yeah.
like she comes up.
Yeah.
Yeah, it's just a big deal right now. We'll be voting with my feet at open enrollment. We already had a do not buy order with our money management team for UHC stock.
Nice.
Yeah, for sure. Well done. YouTube video, you can find episodes of this on our YouTube channel. Video episodes, that's what I'm trying to say. At Glaucomfleckens. Go check that out. Lots of cool perks over on Patreon as well. Bonus episodes, react to medical shows and movies. Hang out with other members of the Knock Knock Hi community. Patreon.com/Glaucomflecken or go to Glaucomflecken.com. Speaking of Patreon community perks, how about a new member shout out to Janine S. Welcome. We're happy to have you in our little family here. Shout out to all the Jonathans as usual. Patrick, Lucia C, Edward K, Marion W, Mr. Granddaddy, Caitlin C, Brianna L, MP Cole, Mary H, Keith G, Parker, Mohammed L, David H, Kaylee A, Gabe, Gary M, Eric B, Marlene S, Scott M, Kelsey M, Dr. Hoover, Sean M, Ryan N, Hawkeye MD, Bubbly Salt, and Shawnee D. Patreon roulette time. Random shout out to someone on the emergency medicine tier. Shout out to Catherine P for being a patron. And thank you all for listening. We're your hosts, Will and Kristin Flannery, also known as the Glaucomfleckens. Executive producers are Will Flannery, Kristin Flannery, Aaron Corney, Rob Goldman, and Shanti Bray. Editor and engineer Jason Ortiz. Our music is by Omer Ben Zvi. To learn about Knock Knock Hi's program disclaimer, ethics policy, submission, verification, license terms, and release terms, go to Glaucomflecken.com. Reach out to us at knockknockhi@human-content.com with questions, concerns, or fun medical puns. Knock Knock Hi is a Human Content production.
Goodbye.
Hey, Kristin.
Yeah.
You know one thing I just can't stop thinking about and talking about?
What?
Microsoft Dragon Copilot.
Yeah, you really love it.
I do. I love it. I love things that just make being a clinician easier.
Mm-hmm. Who
Right?
doesn't?
To help you be able to focus on your patients
Yeah.
more. Streamline the workflow that you have to do, all the administrative tasks.
Yeah, get back to the stuff you like to do.
But you know what? It's not even all of that. That's great. All that stuff is good.
Yeah.
But it's also bringing information to the front of your mind. Being able to what's called surfacing information.
Yes,
Really. So
right.
it's you
All
want to
that
know
stuff that's rusty back there.
Yeah, you want to know medication interactions,
Yeah.
if two medications interact with each other before you order one. Well, Microsoft Dragon Copilot can help you find that information more quickly. You can look up ICD-10 codes. I don't know if
that's
you know what
handy.
those are.
I do.
But it's really helpful to be able to know
because those are
that.
really annoying to deal with.
But they're important,
Yes.
right? You got to know them. And just all these just simple requests, looking at family history, all this stuff. It's just fantastic. It makes your life so much easier. To learn more about Microsoft Dragon Copilot, visit aka.ms/knockknockhi. That's aka.ms/knockknockhi. Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.